Every evening, 30 million adults over the age of 50 look down at their ankles and see something that wasn't there in the morning. Not slight puffiness, but serious swelling, sometimes so severe that pressing a finger into the skin leaves an indent that stays there for 20 or 30 seconds. The medical term for this is pitting edema, and if you're experiencing it, I need you to understand something critical right now. Your ankles are not the problem. They are the messenger. What you're seeing at your ankles is the visible endpoint of a system-wide failure that's happening inside your body at this very moment. And in 80% of cases, the root cause is something your doctor will never examine during a standard office visit. Subscribe to Dr. Waterling right now and hit that like button. We're building this channel on one principle. The system makes money when you stay sick, not when you get better. Every subscriber moves us closer to 1,000 and helps us reach more people who need to hear what conventional medicine won't tell them. I'm going to explain exactly what's happening inside your legs right now, why the swelling gets worse as the day progresses, and 3 specific movements you can perform tonight that will flush accumulated lymphatic fluid and reduce visible swelling within 48 hours. But first, you need to understand the physics of what's actually going wrong, because without this knowledge, you'll keep trying solutions that treat the symptom while the underlying problem accelerates. Look at your ankles right now. If you can see swelling, if your socks leave deep grooves in your skin, if your shoes feel tight by evening when they fit fine in the morning, what you're witnessing is fluid accumulation. But here's what nobody tells you. That fluid didn't originate in your ankles. It came from somewhere else, and your body moved it there because it had no other option. The human body contains approximately 5 liters of blood circulating through your arteries and veins. But there's another fluid system that most people never learn about, and it moves nearly 20 liters of fluid every single day. This is your lymphatic system, and when it fails, swelling is just the beginning. Let me explain exactly what's happening inside your body. Your heart pumps blood through arteries down into your legs. That part works fine. Gravity actually helps that process. But getting blood back up from your feet to your heart, that's where the problem starts. Blood has to fight gravity for the entire return journey. Your veins contain one-way valves, small flaps of tissue that open to let blood flow upward and close to prevent it from falling back down. These valves are supposed to work like a ladder, moving blood up one step at a time with every muscle contraction in your calves. But here's what happens after age 50. Those valves start to weaken. They don't close completely anymore. Blood leaks backward between contractions. This creates pressure buildup in the veins of your lower legs. When venous pressure increases, fluid is forced out of your blood vessels into the surrounding tissue. That's the swelling you see. Your body is literally leaking fluid into the space around your ankle joints because the pressure inside your veins has become so high that the vessel walls can't contain it anymore. Now, under normal circumstances, your lymphatic system would handle this. Lymph vessels run parallel to your veins throughout your entire body. Their job is to collect excess fluid from tissues and return it to your bloodstream. Think of lymph vessels as the drainage system for your body. When everything works correctly, they prevent fluid accumulation by constantly moving excess tissue fluid back into circulation. But the lymphatic system has one critical limitation. It has no pump. Your heart pumps blood. But lymph moves only through muscle contraction and joint movement. If you're sedentary, if you sit for extended periods, if your ankle joints barely move throughout the day, lymph doesn't move either. It accumulates. This is why your swelling gets worse as the day progresses. Every hour you spend sitting or standing still, gravity pulls more blood down into your legs. Weakened venous valves allow pressure to build. Fluid leaks into tissue. And your lymphatic system, starved of the movement it needs to function, can't clear it. By evening, you have liters of accumulated fluid in your lower legs that should have been returned to circulation hours ago. In 15 years of clinical practice, I've seen patients try everything conventional medicine offers for this condition. Compression stockings, diuretic medications, elevation, reduced salt intake. And you know what happens? The swelling comes back. Every single day, the same cycle. Because none of those interventions address the root cause. They don't fix weakened venous valves. They don't restore lymphatic drainage. They manage the symptom temporarily while the underlying circulatory failure continues to worsen. Here's what the healthcare system won't tell you. There is no billing code for teaching you how to activate lymphatic drainage through specific movement. There is no prescription for improving venous valve function. There is no surgical procedure that restores normal lymph flow. So what happens during a typical doctor's appointment? You get prescribed a diuretic to force your kidneys to remove water from your body. This reduces total fluid volume, which temporarily decreases swelling, but it does nothing to address why fluid is accumulating in your ankles in the first place. The venous insufficiency continues. The lymphatic stagnation continues. And now you're dependent on daily medication with its own side effects, including electrolyte imbalance, dehydration, dizziness, and increased fall risk in older adults. Let me be direct with you. This is serious but solvable. Left unaddressed, chronic venous insufficiency leads to skin changes. The tissue around your ankles will darken, a condition called hemosiderin staining caused by red blood cells breaking down in tissue where they don't belong. The skin becomes fragile, prone to breaking down into venous ulcers that can take months to heal and frequently become infected. I'm not saying this to frighten you. I'm saying it because once you understand the cost of every day, you continue sedentary habits without addressing lymphatic stagnation, the motivation to change becomes very concrete. But here's the good news. The lymphatic system responds to mechanical stimulus immediately. You don't need medication. You don't need expensive equipment. You need 3 specific movements performed in the correct sequence with the right repetition count and timing. These movements create the muscle contractions and joint articulations that physically pump lymph out of your lower legs and return it to central circulation. I'm going to walk you through each one step by step. Before we get to the movements, you need to understand one more critical piece. Lymph flows in one direction only, from your extremities toward your heart. That means you cannot just squeeze your ankles and expect drainage. You have to open the pathway first. Think of it like a drain pipe. If the pipe is blocked at the top, squeezing at the bottom does nothing. The fluid has nowhere to go. So the first movement opens your lymphatic drainage pathway. The second movement activates the pump mechanism in your calves. The third movement creates rhythmic pressure changes that physically flush accumulated fluid upward. Movement 1. Opening the lymphatic pathway. This must be performed first. Sit comfortably in a chair with your back supported. Place both hands on your abdomen, just below your rib cage on the left side. This is the location of your cisterna, chyle, and thoracic duct, the main collection point where lymph from your entire lower body drains before returning to your bloodstream. Press gently with your fingertips and make slow circular motions, clockwise, for 30 seconds. You should feel gentle pressure, but no pain. What you're doing is mechanically stimulating the smooth muscle in your lymph vessels, opening the drainage pathway. This signals your lymphatic system that drainage is beginning, preparing the vessels to accept fluid from downstream. Now move your hands to your groin area, specifically the hollow, just below where your hip joint bends, on the inside of your thigh. This is the location of your inguinal lymph nodes, the regional collection point for lymph from your entire leg. Press gently and make small circular motions for another 30 seconds on each side. You're opening the next level of drainage. Think of this as unlocking a series of gates. First the central drain, then the regional stations, and finally you'll activate the local pump in your calves that pushes fluid toward these open pathways. Movement 2. Activating the calf pump mechanism. Your calf muscles are often called the second heart because they generate the mechanical force that moves blood and lymph upward from your feet. But most people never activate them fully. Stand upright with your feet shoulder width apart, next to a wall or chair for balance support. Rise up onto your toes, lifting your heels approximately 3 to 5 centimeters off the ground. Hold this position for 2 full seconds, feeling the strong contraction in your calf muscles. Then lower your heels back to the floor with control. Do not drop suddenly. The controlled lowering is as important as the rising because it creates a squeezing and releasing action on the deep veins and lymph vessels running through your calf muscles. Perform this movement 30 times at a steady rhythm, approximately 1 full repetition every 3 seconds. By repetition 20, you should feel significant muscle engagement. That burn you feel is not just muscle fatigue. It's the mechanical work being done to compress and release the vessels in your lower legs, physically pushing fluid upward. This is not a stretch. This is active pumping. You are manually operating the drainage system that gravity and sedentary behavior have shut down. Movement 3. Lymphatic flushing through ankle articulation. Now that you've opened the central and regional pathways and activated the calf pump, you need to mobilize the fluid that's already accumulated around your ankle joints. Sit down again, this time with your feet flat on the floor. Lift one foot slightly off the ground, just enough to move it freely. Point your toes downward as far as comfortable, hold for 2 seconds, then flex your foot back, pulling your toes toward your shin as far as comfortable, hold for 2 seconds. This creates maximum joint articulation at the ankle. But here's the critical part. While you're performing this flexing and pointing motion, simultaneously rotate your ankle in a circular motion. Make the largest circles possible, really exaggerating the movement. Do 10 circles in one direction, then 10 circles in the other direction, all while continuing the flexing and pointing. This combination creates multi-directional pressure changes in the tissue surrounding your ankle joint. It physically wrings out accumulated fluid like squeezing a wet sponge. You should feel subtle tingling or warmth around your ankles. That's increased circulation. That's lymph beginning to move. Perform this for 2 full minutes on each leg. By the end, your ankles will feel looser, less tight. That's not imagination. That's mechanical drainage. Here is your complete protocol. Perform all 3 movements in sequence, in the exact order I've described, twice per day. Once in mid-afternoon when swelling typically begins to develop, and once in the evening before bed. The entire sequence takes approximately 8 minutes. That's your time investment for measurable swelling reduction. Now, timeline for results. Within the first 24 hours of consistent performance, you should notice less severe evening swelling. Your sock grooves will be less deep. Your shoes will feel less tight by the end of the day. Within 48 to 72 hours, morning residual swelling should decrease. Your ankles should look visibly less puffy when you wake up. Within 1 week of twice daily practice, you should see substantial improvement. The chronic accumulation that's been building for months starts to clear because you've re-established functional lymphatic drainage. But here's what you need to understand. This is not a cure. This is management through mechanical intervention. If you stop performing these movements and return to completely sedentary behavior, the swelling will return within days. Why? Because the underlying venous insufficiency hasn't changed. The weakened valves are still weak. Gravity is still working against you. What you're doing is compensating for that insufficiency by manually operating your lymphatic drainage system through specific targeted movement. Let me tell you about Margaret. She's 67 years old and came to my office convinced she needed diuretic medication because her ankles were so swollen by evening that she couldn't get her shoes back on after removing them at work. She'd tried elevation, she'd bought compression stockings that cost $80 and were so uncomfortable she stopped wearing them after 3 days. When I examined her legs, I could press my thumb into her ankle and leave an indent that stayed visible for 45 seconds. Classic pitting edema from venous insufficiency and lymphatic stagnation. I taught her these 3 movements and told her to perform them at lunch and before bed. She called my office 6 days later and told my assistant the swelling was 70% improved. When she came back for follow-up 2 weeks later, her ankles looked completely different. Normal contour, no visible puffiness, sock grooves gone. She said the single biggest change was that her shoes fit consistently throughout the entire day for the first time in 3 years. Margaret is still performing these movements daily 14 months later, and her swelling has not returned. Now, critical disclaimers. If you have sudden onset swelling in only one leg accompanied by pain, warmth, and redness, that is not simple venous insufficiency. That is a potential deep vein thrombosis, a blood clot that can travel to your lungs and become life-threatening. That requires immediate emergency medical evaluation. Do not perform these movements. Go to an emergency room. If your swelling is accompanied by shortness of breath, chest pain, or rapid heart rate, that suggests possible heart failure. Your heart may not be pumping effectively enough to clear fluid from your body. That also requires immediate medical evaluation, not home exercises. If you have a history of lymphedema from cancer treatment, surgical lymph node removal, or congenital lymphatic abnormalities, these movements may help, but you need guidance from a certified lymphedema therapist who can assess your specific situation. Do not rely solely on this general protocol. If you're taking blood pressure medication or diuretics, these movements may improve your circulation enough that your medication dosage needs adjustment. Monitor your blood pressure if you have home equipment, and discuss any significant changes with your prescribing physician. Do not discontinue prescribed medications based on anything in this video. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers, because it will directly shape what I cover in future videos. Age-related venous changes accelerate after 60, and I want to make sure I'm addressing the needs of those experiencing the most severe symptoms. The movements I've described tonight are based on established principles of manual lymphatic drainage, a therapeutic technique that's been clinically validated for decades. Physical therapists who specialize in lymphedema treatment use these exact mechanical principles. What I've done is distill them into a self-administered protocol you can perform at home without needing expensive therapy sessions. The physics is simple. Lymph moves through mechanical compression. Muscle contraction provides that compression. Strategic joint articulation directs the flow. That's not alternative medicine. That's basic physiology applied practically. One more thing you need to understand. Your diet affects fluid retention significantly. If you consume high amounts of processed foods containing excessive sodium, your body retains water to dilute that sodium and maintain proper electrolyte balance. That retained water accumulates in your lower legs because of gravity, reducing sodium intake to below 2,000 milligrams per day, which means cooking fresh food instead of eating packaged meals will reduce the total fluid volume your lymphatic system needs to clear. The movements handle the drainage. Reduced sodium reduces the load. Also, hydration matters in a way that seems counterintuitive. Many people with swelling reduce their water intake thinking less fluid means less swelling. That's backwards. When you're dehydrated, your body holds onto every drop of water it has, including the fluid pooling in your ankles. Drinking adequate water, approximately 2 liters per day, signals your body that fluid is plentiful, which actually increases urination and reduces retention. Combine adequate hydration with these lymphatic drainage movements, and you're addressing the problem from both sides. If this video helped you, send it to someone you care about, a parent, a friend, someone who might be dealing with swollen ankles and doesn't realize there's a mechanical solution that works without medication. You may have just given them a real chance to avoid venous ulcers, skin breakdown, or years of unnecessary medication. Subscribe to Dr. Waterling if you haven't already. We're providing the information conventional medicine won't take the time to teach you because there's no revenue in it. Every video on this channel is built on one principle. Your body is not broken. You're not helpless in front of your own biology. You just need the right information applied correctly. Your ankles are telling you something right now. They're showing you visible evidence of a circulation problem that's been developing for years. You can keep ignoring it, keep accepting it as inevitable aging, keep trying compression stockings and diuretics that manage symptoms without fixing causes. Or you can spend 8 minutes twice a day performing 3 specific movements that physically restore the drainage function your sedentary modern lifestyle has shut down. The choice is yours, but now you have the knowledge. What you do with it determines what your ankles look like 6 months from now.